I just feel like telling us more about our liver because some of us don't know how important our liver is. That was why we tend to take any sort of things that is capable of damaging our liver and exposing ourselves to somewhere that place is not good for our healthy living. Apart from knowing some of the functions of our liver, in this video I will tell us things that are capable of damaging our liver. You have to take note of them, please. You have to take note of them. This is the essence of the video. Knowing factors that are things to damage our liver. Our liver is very important in terms of detoxification process. That is removal of some factors. That is removal of things that are not good for our body system. It's also important in our body metabolisms, bile production, storage of protein and minerals, storage of carbohydrates, and the rest of some of the functions. But our main focus is to tell us factors or things that can damage our liver. The liver is very important. Just take a look at this example, like a filter. When you have a filter, whatever thing that goes into the essence of the filter is to filtrate and remove out the unwanted substance. So the filter, our liver serves as that filter. Whatever thing we ingest in before our body assimilates it, apart from the other digestive systems, mouth, esophagus, stomach, small and the large intestine, liver also tends to, whatever thing we take in before getting into our various body tissue, the liver tends to filter them to remove substances that are not good for our systems, for us to be discarded, and those that are good for our systems, they can pass through our bodies, our various body organs. So imagine when you are ingesting a very harmful substance to your body, overwork of the liver can damage it. So one of the factors that can damage our liver is alcohol. Heavy drinking of alcohol, excessive drinking of alcohol can definitely damage our liver. Yes, I am saying this. If you are the type that takes alcohol in excess, please reduce it at all, reduce it, or even stop it at all. Otherwise, one day you go to the hospital with a liver fatty disease. So please avoid it or reduce it to the BRS minimum. Number 2 is hepatitis, viral hepatitis like hepatitis B and C. So this hepatitis, that was why it's advised to carry out the test of hepatitis B, and especially hepatitis B, as in when you are negative of hepatitis B, then you take vaccines. This is at the same time I'm telling you the remedy, the precautions and the remedy that you can take to avoid the damaged liver. Then number 3 is medications. Taking in excess medication, unprescribed medication, it can also lead to liver damage. That was why it's advisable for you, before you take in any drug, you have to consult the professional. The professional, that is a medical doctor, people that can prescribe. Tell them I have so and so ailment, because there are drugs that is not good for our liver. So if you don't know that drug and you have a liver issues and you tend to be taking such drug, example acetaminophen can damage our liver. So you don't know it and you just go and be taking acetaminophen, it can't really be harmful to you. So make sure that you consult your doctor before taking any drug. The next is autoimmune disease. Our body tends to fight foreign material. So when the situation whereby our body system recognizes liver tissue as a foreign material, it damages your liver. That's what we call autoimmune liver disease. So please, whatever thing you begin to notice on familiar changes within your body system, rush to the hospital, and the physician will analyze your body system and give you a necessary things. Then we have obesity and poor diet. We are saying obesity. People tend to look at it as a very simple reason. One has to, gather muscles. Yes, it's good to gather muscles, but be careful. Obesity can have a very negative health impact, being it heart, being it liver, being it kidney. So obesity is one of the factors that can damage liver because of the excessive fat deposited in the liver. So the last but not the least is what is chronic diseases such as heart disease. There's a backflow of blood. When the blood passes through liver before going to the heart. So when there's a heart problem and the blood tends to there's a backflow of blood, then the blood tends to be resided in the liver. Too much residing of blood in the liver is going to expand it, and once the liver has been expanded, it's going to fail. So we have what is called congestive heart diseases, which can lead to many organ disorder, being it heart, being it kidney, being it liver, being it any types or any kind of very important organs in the body system. So please, these are the short factors that can damage liver. Environmental exposure, toxins is one of them. When you expose yourself in an environment that is very toxic to your system, it can also damage your liver. There are many factors. Please, what we are saying now, the essence of us doing this video is to give you a clue, that you can manage your life, because life is very important. You don't know the value of it until you've gone to hospital and see how people are suffering from organic conditions, a condition that can only be managed. It can only be managed. It's not a condition that can say you can be cured with it in totality. It can only be managing. When a condition becomes managing, you know what it takes. So if you want to ask me any question, please follow my page and have a chat with me directly. I can answer your question. Make sure that you share this video and like this video. Thank you.